The national vaccination programme is a key weapon in the battle against COVID. But as vaccinations in North East Lincolnshire reach record levels, why are we seeing a peak in infection rates? I spoke to Geoff Barnes, Deputy Director of Health at North East Lincolnshire Council, and Dr Anupam Sinha, Clinical Lead for Adults at NHS North East Lincolnshire CCG, to find out more about their strategy for dealing with COVID and if vaccinations is really the answer.
The vaccination approach is the way out of this, essentially. Enormously important to get as high a number of people vaccinated as possible.
75% of them have had their first dose of the vaccine, and about 56 to 57% have had their second dose of vaccine.
Evidence to date is that the vaccination is extremely effective, and that's really, really good news. We're hardly seeing any cases in our older population now, the vast majority of whom have had those 2 doses.
So science so far has shown that the vaccines are still effective against these new variants. Having said that, it does not mean that you can't catch the virus again.
We'd had low rates in our area since mid-March, but then when the Delta appeared at the end of May, it thrives in indoor environments, it thrives in hospitality settings, it thrives in crowded workplaces, and in the space of literally a week we saw our case rate shoot up from 11 up to around 60. It's gone well over 100 now.
The timing is never perfect. So you've got to think of the impact of the long term, that the people have stayed in their houses, they have put up with this isolation. A lot of people have been affected mentally and psychologically, and we see that every day, day in and day out in primary care.
Unfortunately, what we can see right across the country is people in more deprived areas have lower uptake of vaccination compared with people in more affluent areas, also slightly lower rates in black and minority ethnic communities. That situation is true in North East Links as well. But overall, compared with similar places, we have a generally higher rate of vaccination uptake so far, and certainly a really, really high uptake in our over 60s population. We've got a window of opportunity now over these next few weeks to get people vaccinated.
When you have been on your guards for such a long time, it is very natural to lay back and think, well, we are on top of things. Our numbers have come down. We need to be reminded of the fact every time that we need to keep on maintaining our test and trace system. We need to make sure that we are using the app on our phone.
So please follow all the advice on getting tested if you're symptomatic. Self-isolate as well if you either have symptoms or you're known to be a contact of somebody. Wash your hands whenever you can, wear a face covering in crowded indoor spaces, and maintain those 2-metre social distances as much as you possibly can.
So make sure you get both your vaccinations done, not only the first one but also the second one. Even after getting both the vaccinations done, we should not let our guards down.
Please get vaccinated. The vast majority of people want their lives back to normal. This is the route back to normality.
So the message is clear. If we want to win the battle against COVID, get both your jabs, which is now even easier at the new drop-in centres, get tested twice a week if you are at high risk of catching COVID, use the NHS app when you're out and about, and self-isolate if you get a call. And continue to take precautions. Wear a mask, wash your hands, and keep your distance. And hopefully we can soon get back to some kind of normal.